Lagos.
And the Society for Family Health has expressed concerns over the increasing spread of tuberculosis, TB, among children in Kano State. Pharmacist Jane Adizu, the lead for TB and corporate philanthropy at the Society for Family Health, made this known during a roundtable discussion on enhancing child-focused TB care and treatment in Kano. She added that Kano, being Nigeria's most populous state, has a widespread issue with childhood TB, saying that for every 100 cases, 5 are children.
Today we have gathered the people that can take decisions as regards what strategies or what steps we can take so that we can see better outputs and our children can be treated and free from TB. For Kano State, we have a 5% TB youth. So what that means invariably is that for every 100 TB cases, 5 of them are actually children. So it's very important to be able to make sure that those that have the disease or are infected with the disease come for treatment and they are treated completely, because we know TB is curable and there's no reason why a disease that is totally preventable should be causing death among our children.
Despite the fact that we are making progress, we have the highest number of TB detection in Nigeria. Kano has the highest number of TB detection in Nigeria, more than any other state. But most of our TB patients are adults. But you find out that we are not getting more and more of the children. And those children, they have TB, but they don't know. And we don't know because we have not screened them. That's why we are calling on parents. Awareness is important. Information is power. Knowledge is power. Let parents hear this. Let parents bring their children to the nearest facility for screening. When we screen children, we will be able to diagnose children on time and place them on treatment.
It was a very good meeting that discussed bring about professionals from all over the states, and we discussed at length the issues, challenges with TB case finding in Kano State to develop and support a childhood TB case finding in Kano State. Of course, 7% is not good for the state. We look at the WHO standard of about 3% total case finding in Kano State and using childhood TB. So I think it's important, it's very good.
And to discuss further the outbreak of TB in Kano, I'm being joined by Jane Adizu, a pharmacist with the Society for Family Health. Hello, Jane.
Hello. Can you hear me?
Absolutely clear. Tell us, what is the cause exactly of this outbreak in Kano at this time?
Thank you very much. Like you said during our roundtable meeting, Kano State, first and foremost, is one of the most populous states in Nigeria. And we know for certain that because of the population and the high urban slum, we have people clustered in locations.
Are you still with me, Jane? Are you still there, Jane? Well, it appears Jane Adizu has gone offline. Are you still there?
Good afternoon.
Okay, go ahead,
for
Jane.
us in Society for Family Health, our intervention is to see how we can prevent the spread of TB among children. Like we say popularly in TB program, TB anywhere is TB everywhere. So ours is to see how we can find the missing cases and get them enlisted or onboarded for treatment so that they can be treated completely. Now, in the context of children, just like we said during our roundtable meeting in Kano, children are susceptible to contracting this disease. One, their immunity is not as strong as adults, and two, we know generally that they on their own are more a vulnerable population as it were. So for us in SFH, we want to see how we will continue to find the missing cases amongst children, get them diagnosed very promptly, and of course, enlist them for treatment so they can be completely treated and cured of the disease. We know definitely that if this is achieved, Nigeria will be a free society from TB. Thank you.
Oh, all right. Is there, what's the casualty figure at this time, given that, children are quite susceptible to diseases, even TB inclusive? What's the casualty figure at this time? Can you hear me? Jane, are you still there? Well, there appears to be some network fluctuations there, but we've been talking with a pharmacist with the Society for Family Health, Jane Adizoe, talking about the outbreak of tuberculosis in Kano State. Moving on now, have you heard about Noma disease? Not quite sure. Well, Noma is a fatal disease that occurs in young, malnourished children between ages 2 to 6 years, and it destroys their facial tissues and bones. The good news is that the Federal Ministry of Health has begun an initiative to ensure early detection of the disease with the training of health workers in Abia State to take the message to prevention to the rural areas.